A lot of our patients ask, am I really going to wake up with permanent teeth, new teeth, in my head that do not come in and out? And you will, and that is the truth. You will wake up with a permanent bridge in your mouth that is yours, that we've designed ahead of time so you get to see it ahead of time. What we don't want is horse teeth, or those patients that very obviously went to a dentist and the teeth do not fit within their face. So we're going to show you everything ahead of time. You're going to wake up with those permanent teeth, and then we have to let biology occur. We have to let your body heal. Anyone delivering the zirconia, the very hard final material, the next day or doing that is tempting biology, because the body is going to heal. Those wounds are going to shrink, they're going to contract, and a space is going to develop underneath. And then they have no test drive that our patients get. You're going to have a 3-month test drive. You're evaluating it. Do you like the middle? Are they wide enough? Are they big enough, small enough? Whatever goals you have to accomplish, if you have an old picture of yourself, bring that, and we can accomplish those goals. And then when healing occurs over that 3-month period, then we make another prototype that fits the gums, and then we go to zirconia with that one. But we can't cheat biology. The body has to heal.